Question 1. In medical terminology, understanding the correct combination of word parts is crucial. Consider the term osteomyelitis. Which of the following best describes its structure and meaning? A. Prefix osteo, bone, plus root myel, muscle, plus suffix itis, inflammation, equals inflammation of the bone muscle. B. Prefix osteo, bone, plus root myel, spinal cord, plus suffix itis, inflammation, equals inflammation of the spinal cord bone. C. Root osteo, bone, plus combining vowel o plus root myel, bone marrow, plus suffix itis, inflammation, equals inflammation of the bone and bone marrow. D. Root osteo, bone, plus root myel, muscle, plus suffix itis, inflammation, equals inflammation of the bone muscle. Correct answer, C. Root osteo, bone, plus combining vowel o plus root myel, bone marrow, plus suffix itis, inflammation, equals inflammation of the bone and bone marrow. Explanation. Osteomyelitis is composed of osteo, bone, myel, bone marrow, and itis, inflammation. The combining vowel o is used to connect the roots. Therefore, the term refers to the inflammation of the bone and bone marrow. Question 2. Which of the following terms refers to the surgical removal of the gallbladder? A. Cholecystectomy. B. Cholelithiasis. C. Cholecystitis. D. Cholangiography. Correct answer, A. Cholecystectomy. Explanation. Cholecystectomy combines cholecyst, gallbladder, and ectomy, surgical removal, indicating the surgical removal of the gallbladder. Question 3. Dr. Thompson is preparing to discuss a patient's diagnosis and treatment plan. The patient, Mr. Alvarez, has limited English proficiency. Dr. Thompson considers using a family member as an interpreter to expedite the process. What is the most appropriate action for Dr. Thompson to take in this situation? A. Proceed with the family member as an interpreter to save time. B. Use a professional medical interpreter to ensure accurate communication. C. Rely on written materials in English, assuming the patient can understand. D. Delay the discussion until the patient learns more English. Correct answer, B. Use a professional medical interpreter to ensure accurate communication. Explanation. Using a professional medical interpreter ensures accurate and confidential communication, adhering to ethical standards and legal requirements for informed consent and patient understanding. Question 4. The term tachycardia is used to describe a condition related to heart rate. Which of the following best defines tachycardia? A. Slow heart rate. B. Normal heart rhythm. C. Fast heart rate. D. Irregular heart rhythm. Correct answer. Explanation. Tachy means fast and cardia refers to the heart. Therefore, tachycardia denotes a condition where the heart rate is abnormally high. Question 5. Which term describes the inflammation of the liver? A. Hepatomegaly. B. Hepatitis. C. Cholecystitis. D. Nephritis. Correct answer, B. Hepatitis. Explanation. Hepat refers to the liver and itis denotes inflammation. Thus, hepatitis is the inflammation of the liver. Question 6. Nurse Emily is documenting a patient's symptoms in the electronic health record, EHR. She notices that some of the abbreviations she intends to use are on the Joint Commission's Do Not Use list. What should Nurse Emily do to ensure proper documentation? A. Use the abbreviations anyway, as they are commonly understood. B. Replace the abbreviations with their full terms to avoid confusion. C. Create new abbreviations that are not on the list. D. Skip documenting those parts to prevent errors. Correct answer, B. Replace the abbreviations with their full terms to avoid confusion. Explanation. To prevent misinterpretation and ensure patient safety, It's essential to avoid using prohibited abbreviations and instead write out the full terms. Question 7. In medical terminology, what does the prefix Brady indicate? A. Fast. B. Slow. C. Normal. D. Irregular. Correct answer B. Slow. Explanation. The prefix Brady means slow. For example, bradycardia refers to a slower than normal heart rate. Question 8. Which term refers to the surgical removal of the appendix? DMU edu. A. Appendectomy. B. Appendicitis. C. Appendostomy. D. Appendotomy. Correct answer A. Appendectomy. Explanation. Appendectomy combines appendix and ectomy, surgical removal, indicating the surgical removal of the appendix. Question 9. Mr. Chen has been diagnosed with a terminal illness. He expresses his wish not to receive any life-prolonging treatments. What document should be completed to ensure his wishes are respected? A. Living will. B. Power of attorney. C. Do not resuscitate DNR order. D. Advance directive. Correct answer D. Advance directive. Explanation. An advance directive is a legal document that outlines a patient's preferences for medical treatment in situations where they may be unable to communicate their decisions. Question 10. What does the suffix algia mean in medical terminology? A. Inflammation. B. Pain. C. Swelling. D. Tumor. Correct answer B. Pain. Explanation. The suffix algia denotes pain. For example, neuralgia refers to nerve pain. Question 11. In respiratory terminology, which of the following best describes the condition atelectasis? A. Infection of the alveoli. B. Inflammation of the trachea. C. Collapse or incomplete expansion of the lung. D. Fluid accumulation in the pleural space. Correct answer C. Collapse or incomplete expansion of the lung. Explanation. Atelectasis comes from atal, incomplete, and ektasis, expansion. It refers to the partial or complete collapse of the lung or a portion of the lung, often due to obstruction or pressure on the lung tissue. Question 12. Which is the most appropriate breakdown of the term gastroenterology? A. Gastro/o stomach plus enter-o intestine plus logi study of. B. Gastrointestine plus entero liver plus logi disease of. C. Gastro/o liver plus enter-o spleen plus logi condition. D. Gastro/o digestive tract plus enter-o blood vessels plus logi removal. Correct answer A. Gastro/o stomach plus enter-o intestine plus logi study of. Explanation. Gastroenterology is the medical study of the stomach, gastro/o, and intestines, enter-o. The suffix logi denotes the study of a subject. Question 13. Dr. Reed is completing a surgical report. She abbreviates International Normalized Ratio as INR. A junior nurse misreads it as insulin not required and prepares insulin incorrectly. What best practice could prevent this error? A. Avoid all abbreviations in documentation. B. Use only abbreviations approved by institutional policy and educate staff regularly. C. Depend on electronic autocorrect tools. D. Assume experienced staff will understand all common abbreviations. Correct answer B. Use only abbreviations approved by institutional policy and educate staff regularly. Explanation. To prevent misinterpretation, only standardized and institution-approved abbreviations should be used. Abbreviations like INR are commonly misread if not clearly contextualized. Question 14. Which term means inflammation of the urinary bladder? A. Urethritis. B. Nephritis. C. Cystitis. D. Pyelonephritis. Correct answer, C. Cystitis. Explanation. Cyst O refers to the bladder and itis to inflammation, so cystitis is bladder inflammation, commonly due to infection. Question 15. Which of the following best defines the medical term dysphagia? A. Difficulty speaking. B. Difficulty breathing. C. Difficulty swallowing. D. Difficulty digesting. Correct answer, C. Difficulty swallowing. Explanation. Dys means difficult or abnormal, and phagia refers to swallowing. Dysphagia is difficulty in swallowing, often seen in neurological or esophageal disorders. Question 16. Ms. Ibrahim is reviewing patient records for audit. She notices one progress note has been altered using correction fluid. What action best aligns with legal documentation standards? A. Rewrite the note on a new page. B. Use correction fluid, initial and date. C. Strike through with a single line. Write correct entry with date and initials. D. Ask the original writer to delete and retype the entry. Correct answer, C. Strike through with a single line. Write correct entry with date and initials. Explanation. Medical records must maintain a clear audit trail. Errors should never be erased or hidden. The accepted method is to strike through, correct, date, and sign. Question 17. Which of the following terms refers to an abnormal heart rhythm? A. Bradycardia. B. Tachycardia. C. Arrhythmia. D. Cardiomegaly. Correct answer, C. Arrhythmia. Explanation. Arrhythmia is the lack of rhythm rhythmia in the heartbeat. It covers any irregular heartbeat, too fast, too slow, or erratic. Question 18. Which of the following is the most accurate description of the suffix megaly? A. Pain. B. Swelling. C. Inflammation. D. Enlargement. Correct answer, D. Enlargement. Explanation. The suffix megaly means enlargement. For example, cardiomegaly means enlargement of the heart. Question 19. Nurse Patel receives a verbal order from a physician to administer medication. Due to noise and fatigue, she mishears the dosage. What should Nurse Patel have done to ensure compliance with safe practice standards? A. Assume standard dosing applies. B. Document as heard and proceed. C. Repeat the order back for verification. D. Wait until after administration to confirm. Correct answer, C. Repeat the order back for verification. Explanation. The standard protocol for verbal orders is the read-back method. Repeat the order aloud to confirm accuracy, preventing medication errors. Question 20. What does the term nephrolithiasis refer to? A. Inflammation of the bladder. B. Cancer of the kidney. C. Kidney stone condition. D. Infection of the ureter. Correct answer, C. Kidney stone condition. Explanation. Nephr/O refers to the kidney and lithiasis to stone formation. Nephrolithiasis is the presence of kidney stones. Question 21. In the word hemiparesis, which part refers to half? A. Paresis. B. Hemi. C. Hemo. D. Paresis. Correct answer, B. Hemi. Explanation. The prefix hemi means half. Paresis refers to weakness. Hemiparesis is weakness on one side of the body, often due to stroke. Question 22. Mr. Lopez is discharged from the hospital with written instructions. He returns 2 days later claiming he was unaware of medication side effects, though he signed the paperwork. What is most critical in determining legal adequacy of his informed consent? A. Patient's literacy level. B. Whether verbal counseling was provided, along with written documents. C. Whether the patient signed the form. D. Hospital policies on medication. Correct answer. B. Whether verbal counseling was provided along with written documents. Explanation. Informed consent isn't just about signing documents. Patients must fully understand the information, which often requires verbal explanation and confirmation of understanding. Question 23. Which of the following terms refers to a surgical procedure to repair a joint? A. Arthroscopy. B. Arthroplasty. C. Arthrectomy. D. Arthrotomy. Correct answer. B. Arthroplasty. Explanation. Arthroplasty combines arthro/o, joint, and plasty, surgical repair or reconstruction, indicating joint repair or replacement surgery. Question 24. Which of the following terms means surgical puncture to remove fluid? A. Ectomy. B. Stomy. C. Centesis. D. Otomy. Correct answer. C. Centesis. Explanation. The suffix centesis denotes a surgical puncture to withdraw fluid, as in amniocentesis. Question 25. Ms. Daniels is a patient with cognitive impairment. She insists on signing her own surgical consent. Her family disputes her capacity. What should the care team do? A. Allow her to sign if she is alert. B. Proceed without further evaluation. C. Refer for formal capacity assessment. D. Ask a nurse to co-sign in good faith. Correct answer. C. Refer for formal capacity assessment. Explanation. When a patient's capacity to consent is uncertain, a formal assessment is legally and ethically required before proceeding with any treatment. Question 26. What does the term epidermis refer to? A. The inner layer of skin. B. The topmost layer of skin. C. The subcutaneous tissue. D. The sebaceous gland layer. Correct answer. B. The topmost layer of skin. Explanation. Epi means upon or above, and dermis refers to the skin. The epidermis is the outermost layer that serves as the first line of defense. Question 27. Which word part means vessel? A. Cardi/o. B. Angi/o. C. Hemo. D. Other/o. Correct answer. B. Angi/o. Explanation. Angi/o means vessel, used in terms like angioplasty, repair of a blood vessel. Question 28. A physician dictates the patient was prepped and draped in the usual sterile fashion. The transcriptionist types the patient was prepped and raped due to a voice recognition error. What is the proper course of action? A. Leave it uncorrected to avoid altering the record. B. Alert the physician and follow correction protocol. C. Delete the entire entry. D. Ask another physician to amend the note. Correct answer. B. Alert the physician and follow correction protocol. Explanation. Errors in transcription must be corrected following documentation policy, by the originator or through appropriate channels, and the original error must remain visible if corrected. Question 29. Which term best describes inflammation of the inner lining of the heart? A. Myocarditis. B. Endocarditis. C. Pericarditis. D. Cardiomyopathy. Correct answer. B. Endocarditis. Explanation. Endo means inner, card refers to the heart, and itis means inflammation. Endocarditis is inflammation of the inner lining, often caused by infection. Question 30. Which of the following terms means condition of blue skin? A. Erythroderma. B. Cyanosis. C. Melanosis. D. Leukoderma. Correct answer. B. Cyanosis. Explanation. Cyano means blue, and osis indicates a condition. Cyanosis is a bluish discoloration of the skin due to oxygen deficiency.